looking at those dates. But at least one thing we have done is to be able to pick out the severe cases and then take them to hospital such that we can, one, reduce mortality. Then the general provisions that have been put in of restriction of sectors is to then be able to reduce on the number of the sick, which for us we call morbidity. Who are the people who are getting the disease? So again, that is what is happening. But what we have seen in other countries is COVID has a way of overwhelming the health system, no matter how good it is. If, as doctors, we are human like anybody else. So if I have a staffing of about 100, and if 20 got COVID, and all of a sudden they are away for 2 or 3 weeks, you have more or less happening. Now we need to be able to protect the frontline health workers who are there, such that if you come to hospital, you have somebody take care of you. And just again to reiterate, as regards urban area, the number of cases, we still have COVID in the community. People are still there. Transmission is still ongoing, and this can be reflected by the deaths that are also happening. We are having severe cases, and our hospitals are also feeling the strain of the cases that are there.
Akol, yes, let's hear from you.
Thank you, Ndugu Jagenda. I think my take on this is that I think as a continent, because the Pan-African slogan is one struggle, many fronts. The struggle is the fight against COVID-19. But every country, I think, is its own front, because, of course, others are taking this path, the others taking the other path. For example, there are countries that actually have not believed in the vaccination. Others actually sticking, saying, look here, we need to have an African solution. So we are taking different fronts in this. But what is very important is how do we harmonize these fronts in the fight against COVID-19 as a continent. And this also has brought, we had AIDS here in Uganda. Seriously, we had is it Nanyonga, who actually made a fortune out of it. We had the Mzovd of Tanzania in Loliondo, and you saw how people really made pilgrimages
Loliondo in
Tanzania. Yeah, to go and actually for treatment, and it turned out to be a hoax. So that is how every other time there is such a pandemic whereby there is a serious occurrence, a serious disease, out of panic, people will end up believing in anything. So this is where perhaps governments on the African continent need to come out and give serious leadership, and perhaps put up measures to control such behaviors. Now in Uganda, we've heard of the COVID-X, and ideally you can see now the price is shooting from 5,000 to 10,000. Now it goes to up to 60,000. So I think that such kind of behavior where we get opportunists who make a fortune out of such pandemics is really not African, because African is how do we solve a problem that is amidst us together. So my view is that as we're getting a cure for COVID, as we're trying to control the spread of COVID, I think really governments need to come out, yes, so that they can really save people from extortion, save people from exploitation, yes, so that we can live with the fight one day at a time, without actually again affecting other people, because we've heard of cases where really people are losing property in millions, and again losing the person they were trying to treat.
And land title.
Yeah, land title.
And land titles. Yes. Dr. Enu, talk about this. Okay. Good morning, Dr. Msoke. We're happy to see you, and hope we'll hear you.
Good morning, Mr. Jagenda.
Well, I'm thankful to hear from you, live from Sierra Leone, where you are this morning. First, speak to us and tell us what the time is in Sierra Leone, how it is, and whether you can actually see us and hear us well.
Yes, I'm getting you well, and thanks once again for giving me this opportunity to talk to us. And good morning to the fellow panelists, and good morning to fellow Ugandans out there. The situation here is more or less what we see elsewhere on the continent and also what we are seeing in Uganda. We are currently going through what we are calling the third wave. We have had two similar ones before, but this is
Dr. Msoke,
that we are dealing with.
Dr. Msoke, hold it there. You have a very clean picture of yourself. We can actually see you, but your audio is too low. We are missing out on the very good submission that you are giving to us. We do not know whether it is your site where you are or some other thing, but I think we need to increase on your audio because we do not want to miss out on any of the things that you are telling us this morning. We just want to be sure that we can actually hear you very well. I do not know whether it's a technical problem here or it is with you. I don't know how your audio is there. Can you hear us every well?
Yeah, so I'm actually hearing you very well. I'm surprised that you cannot hear me.
Oh, okay. Somebody needs to help us because we need to we need to get to Dr. Msoke. We're seeing him. He has a very stable picture, but the audio is not as we expect it to be. Doctor, just hold it there. Let's work on your volume or audio, then we come back to you. In the meantime, let's talk to Dr. Yen in studios here, as we tend to see what we can do with you that side. We'll make sure that we get it there. Dr. Yen, coming back to you, I have a statement here that I want to read to you from the CDC Africa, and the director of CDC Africa says it's frightening to see what is going on across. John Nkenga Song, the director for Africa CDC, says this is the first time that we are beginning to see countries report that their health systems, the hospitals, are completely overwhelmed. Now, it's a problem that is overwhelming all of us, and one of the challenges that we have is that we have a big population of 1.3 billion people, but just 1% of those have been vaccinated. If vaccines are the solution or the way forward or the next thing to do, and we just at 1%, 99% of Africans have not yet been vaccinated fully. So where does that leave us as a continent? Where does that leave the rest of us as Africans as we battle this Delta wave?
Yeah, definitely. Only having 1% of your population does means we have not even hit the threshold where you'd want to protect our population. So it leaves us at a very, very precarious level. And as you said, we need to open up the channels for vaccines to come into Africa. I know the Africa CDC has opened up a collective bargaining entity whereby all African countries will be able to access our vaccines through the African CDC. But as you know, between me and you, there has been, what can I say, there's been a lot of internal looking in from most of the countries that can be able to provide these vaccines. India, when India was hit by that variant and the cases really exploded, then they stopped they kind of reduced on the exportation of vaccines to Africa. Of having the money, you may have the money, but you cannot be able to get the product. And the other front that is being negotiated is because we know the vaccines are there,